Thanks everyone for joining us here today for this event on shaping a healthier future, policy solutions for preventing and managing obesity. I know how hectic and busy the World Health Assembly is for all of you, so the fact that you've joined us here bright and early today on this rather gloomy Geneva day is very much appreciated. So thanks all for being here, and thank you to our sponsors Novo Nordisk for making this event possible as well. So in terms of what we're going to be going through today, I'm going to start off with a short presentation in which I'll go through the Obesity Action Plan Playbook that Economist Impact has put together, again sponsored by Novo Nordisk. You've got abbreviated versions on your tables and also a QR code on the back should you wish to go and look at the full hub there as well. Then we're going to have a fantastic panel discussion with our esteemed panelists over there. And we'll be talking about sort of some of the broader policy solutions and where we need to see more action, faster action, and more coordinated and effective action taking place to really try to start to see the progress that we need to see on obesity. And then at the end, we will be having a really fun part, which is where we get to have some roundtable discussions with all of you. So we've got a few questions that we're going to be putting out to you. I will be up on stage telling you when you need to move to the next question and keeping you on target. But it's a great opportunity. We've got a great mix of people in the room today, so you'll get a great chance to talk to lots of different people, share some ideas, and hopefully get a bit more out of the discussion. Our panelists will also be joining tables to take part in that discussion as well. And then afterwards, we will also have time for a light lunch and some additional networking if you are able to stay for a bit longer after we finish up the main event. So in terms of the policy playbook that we put together, I'm not going to go into a huge amount of detail. I'm just going to give you a sort of a teaser of it so that you can go away and have a look at it for yourselves later. But I won't go over all of the statistics here because I think the people in this room probably either know very well or even authored some of these statistics. So I shan't go over them. But we know that obesity is a global public health issue, but one that is still not really receiving the attention or the action that is required to sort of really get on top of trying to tackle it. So what we did in putting together the National Obesity Action Plan Playbook was we wanted to create a practical framework, so a really practical tool that people could use when either creating or assessing their own national obesity action plans. And what we were trying to do was to also highlight best practice. So again, keeping with that practical theme, we have a lot of examples in there, case studies from different countries and things like that. So it's a really practical tool that you can use. And also, as you'll see across the framework when I present it in a moment, it's really about this coordinated, multi-sectoral, equitable action, that whole of society approach that we know is needed to really try to effectively tackle obesity globally. So I shan't go through all of the domains here or anything or read into much detail, but what I wanted to get across to you in showing you this slide was this jigsaw representation of our framework. And this is really to show you that at the heart of it, it has this whole of society approach. But the reason we chose the jigsaw motif, I know it's a very well-used motif, was to really hammer home to people that no one part of this framework, no one component is the thing that's going to solve obesity. So this is why we wanted to bring this all together, really kind of building on the health in all policies sort of concept, but really trying to sort of emphasize here that this whole of society approach is needed, taking it that step further. So we cover things like public awareness and education, monitoring and evaluation, really important, often overlooked. We saw this in a lot of plans from the past where there wasn't necessarily actually any sort of monitoring or evaluation of whether we've achieved what we set out to achieve in creating this plan. Funding, sustainable funding is such a key thing here as well. Is there allocated funding to implement this plan? Or is it just a load of great ideas that may never go anywhere? Physical activity promotion, nutrition and fiscal policies, and obesity management. So really trying to hit all of those key ways in which we both prevent and manage obesity. And as I say, I won't read through that whole part on the right-hand side, but that's just to emphasize the way that the playbook is structured in a very practical sense. So we have the domain, then we have what we are calling a core component. So this is the sort of minimum standard of what we think should be included in all national obesity action plans. And then we have the best practice element here. So that's taking it one step further. And really the aim of the playbook is, if you've already got a national action plan, fantastic. That's the sort of centerpiece of your obesity policy. And what you can do is use this tool to go through and see, have we got all of the core components? Is there any areas where we could stretch ourselves and look to best practice examples? If you haven't got a national obesity action plan, here are the core components that you need to include in one. So it's really designed to be a practical tool that helps people to either create or improve national obesity action plans. So the QR code there is to go and view the whole playbook. It is on the abbreviated versions on your table, so don't worry if you're not able to get your camera activated quickly enough today. But I would also encourage you to go and have a look at the whole of the hub that we have there. So the playbook is part of a broader program, and in that we also have a series of multimedia articles in which we explain some of the key drivers and causes of obesity, but in a really accessible and engaging way. So we've got great animations that help to explain how the appetite system works and how our environment influences our risk of developing obesity, but also can affect our ability and our choices in terms of trying to make changes to our lives as well. So I'd really encourage you to go and have a look at the hub as a whole as well. But what I will do now is to introduce our fantastic panel for you today. So I haven't introduced myself, I realise now, which is Presenting 101. So I'm Ellie Vaughan. I'm a Senior Manager at Economist Impact, specialising in health policy and insights. So I'll welcome to the stage first Yanis Gikas, who is Permanent Representative of Greece to the United Nations.
All right. Well, good morning, everybody.
Thank you. And then Martine Laville, who is Professor Emeritus and Hospital Practitioner at Claude Bernard University Lyon.
Nice to be here.
And Francesca Celletti, who is Senior Advisor, Nutrition and Food Safety Department at the WHO. And then finally, Dan Beattie, who is Senior Director, Global Obesity Policy and Public Affairs at Novo Nordisk. Thank you to our panel. So, starting our conversation today, I really wanted to sort of reflect on the fact that if we look at the various targets around obesity, so some of the WHO targets, but also SDG 3.4, the fact is that very few countries are on target to reach these, and the majority are going to miss these really important targets. And so I really wanted to start the conversation by talking about what kind of key actions we could take in, say, the near term, the next, say, 5 years, to really try to bring about change here and impact. So I wanted to come to you, Yanis, first, please. So I know that Greece has an ambitious plan focused on childhood obesity, and I was just wondering if you could talk me through sort of an overview of that plan, but also what your short-term priorities are in putting that together.
Okay. Well, thanks, Ellie, and good morning to everybody again. I think the Greek experience is actually very interesting. Why is that? Because the problem of obesity in Greece is quite severe. We have 60% of adults who are overweight, 25% are actually obese, and the percentage for children is 30% overweight and 10% obese. So we have a very severe problem, which we sort of sleepwalked into, I think, just as the rest of the world, because all these lifestyle, environment changes, they sort of ambushed us collectively. I've been looking at the older national plans for obesity, and they focused not so much on treating it as a horizontal societal problem, but more in addressing specific aspects like anorexia or bulimia or other problematic cases. But now we all realize that this is a horizontal societal problem, needs a society-wide approach, a whole-of-government approach. So that is the one lesson that I can put forward from Greece, that you really have to adopt, the government has to adopt a really strong coordination mechanism. It has to adopt a integrating health, health in all policies policy. Finland is a leader in that. We're trying to follow good practices in that. So in every piece of legislation, there are health aspects. You need to take these into account. Then you have to involve all the government ministries and make sure that the health aspects are involved. And for that, you need a really strong coordination mechanism. Now, in that respect, Greece was actually fortunate because it had this economic crisis, then we had the pandemic, then we had the Russian invasion of Ukraine, and the energy crisis. So all these crises really needed a very strong central coordination mechanism. We've set up under the Prime Minister, who has a real personal interest in health issues. We have a general secretariat for coordination, and they coordinate all these horizontal aspects. They have the game plan. They have each ministry is called on to produce a plan, short-term, long-term, and then they are accountable to. The second main lesson we learned was digitalization. Digitalization is so key for all this. Cost reduction, data gathering. Data gathering we will hear is so important. So that is the general overview. Now, on the short-term priorities, I think I've already mentioned them, but I can go into detail if you wish. They are to fully integrate obesity prevention and management in the health services. So in that sense, it's very important that we have characterized obesity as a disease, although it's very important for us to do this in a way that does not lead to discrimination or exclusion or stigmatization. But it is a disease, and what does that mean? That we can prescribe drugs where this is necessary, we can take measures, we can integrate all the actions for facing obesity into our budget, the mainstream health budget. So then we need to expand access to preventive services, and this means nutrition, psychological support, counseling, et cetera, et cetera. We have to develop, these are our short-term actions that we're taking actually. Develop and strengthen multidisciplinary care teams, which are doctors, dietitians, psychologists, psychotherapists, physiotherapists. We need to promote healthy lifestyles even more. What does that mean? We have to go to the schools. We have to go to the universities. We have a network of universities who are disseminating the main messages. If I'm taking too long, please tell me. And so we have to promote the healthy lifestyle and environment because what we are facing now is a society-wide challenge, which is that we have adapted from an evolution point of view to have scarcity of food, scarcity of, and now suddenly we are in a position where there's an overabundance. It's obvious, but it is a very strange situation and a very difficult one to face because you need a horizontal aspect. So then we are implementing public health campaigns to encourage healthier eating. We are introducing policies to improve food environments, which means reformulating commercial foods, restricting marketing of unhealthy products. Food labeling is a special issue that has its special problems because we need a good food labeling system, but it mustn't be simplistic. It can't give a Diet Cola a better grade than olive oil because the Diet Cola has 0 calories because of an artificial.
You have to adopt Nutri-Score.
So we need a more complex way to do these things. So then we have the policy system and reform. We have this whole mechanism of control we have mentioned. But one thing that we have done in Greece, and we are doing it from a top-down approach, from the Prime Minister, the ministers, is to elevate obesity as a central problem. It is a central problem because it leads to so many diseases, heart disease, cancer. So it is one of our central challenges, and it has to be taken as this. Then we have, of course, the cross-sector collaboration. Health ministry, education ministry, agriculture ministry, but not only that, the housing, the ministry responsible for housing is developing a program for affordable housing. Why is that important to obesity? Because affordable housing is basically the basis to reduce inequalities and to also to ensure that everybody has a minimum standard of living and minimal income, because obesity is linked to long-term unemployment. So even housing is a very basic aspect. Another short-term priority is to improve the way we monitor and evaluate progress. And there we have digitalization again. We need to improve, and we are improving the system. We are putting digital tools throughout the health system. This is facilitating the interface of patients to doctors. It's reducing bureaucracy. It's actually reducing inequalities, because when the system is automatic, and then you actually have faster service for all layers of society, whatever their income. So digital and data collecting is very, very, very important. And there it goes to our last short-term priority, which is to track obesity prevalence in a more efficient manner and the related health indicators. And that way we have the loop and we feed back what are the gaps in the policy we have, what are we doing. It's extremely complex. I took a look at the action plan just for 2025. Just the health ministry has like 9 draft laws it's going to present to Parliament, which have this aspect of fighting obesity. 9, just the health ministry. And then we have all the other ministries that are preparing laws which have particular aspects which affect the whole problem. It's a really difficult problem. It takes a society-wide effort. It needs buy-in from the citizens. It needs the active encouragement of the media to be sensitive to this and promote it. It needs academia. It needs partnerships with WHO and other international organizations to get funding. It needs all this stuff.
Yeah, I think that's a great overview of the plan, and I think it's a really powerful example of where looking at obesity as a whole of society issue, and that's a really important thing actually, isn't it, in terms of the causes of obesity lie not just in the health sector, the solutions to obesity lie not just in the health sector, but also the benefits that will be reaped by effectively preventing and managing it will also be felt across the whole of society, which is why that approach is so important. And Francesca, I wanted to come to you next from the sort of international perspective, because obviously you're a co-author on the WHO acceleration plan. You know, there's best buys, there's quick wins, etc. And I was just wondering, building on what Yanis has said in terms of the sort of the approach Greece has taken, what do you think are some of the priorities that national governments should be looking at in terms of how they prevent and manage obesity?
Well, thank you, and thank you so much for the introduction by Greece. And it's great to know that the country is really moving forward in the response. From the WHO perspective, in fact, what I would need to say is that this is a big matter. This is a crisis of pandemic dimension. And as such, it really needs a systematized response, and also one size doesn't fit all. That's what we know. And it is, in fact, in that context that WHO has launched a few years back the acceleration plan. And I'm actually taking on over the baton from Francesco. That was all under his vision and leadership. And that's why the acceleration plan, it is where it is today. So thank you, Francesco. What WHO is trying to do with the acceleration plan is really to put in place an agile platform that focuses around few pillars that are essential in this pandemic response. And this is definitely the political element, the political commitment at the international level and also at national level, the political engagement. This is the step one. We have seen in previous responses of epidemic and pandemic how the national political lead was a fundamental determinant in the success of the response. Of course, there are certain core technical elements that need to be put in place. And this is something that is also very important, and I'll get back to that to answer your question, Ellie. But also the advocacy component at all different dimensions of society. The accountability is an extremely important factor. Accountability of keeping the countries and the global community on target. And the national and global accountability is a fundamental component. And of course, harnessing all the science. The science is an ally in this in the response. And we really have to be vigilant, attentive of how, on one side, we can inform the science, and on the other, on the need, on the programmatic needs, and on the other side, how we can use that science and make it available. What we have been observing, that there are three critical elements that at least in our experience, or better, in the experience of the front-runner countries, and it's great to see some of them today, like Simone is actually leading the response with the Mexican government and is one of the first ones that joined the acceleration plan, and maybe you can say something about it, and I pass the word to you, Simone. But what we have seen that what is needed is population intervention. That is, we need a population response. We need population that are target to all age group in the population, to all countries and to all different layers of society. The second fundamental component is a health system transformation, not only in terms of treatment and management, but also use the health system platforms through the life course to integrate prevention efforts. And I go back to that. And then the third element, which sometimes is overlooked, at least so far, is the delivery component. It's not only a matter of the what, it's also a matter of the how. So a particular careful and well-designed from the start implementation strategy is needed. An implementation strategy countries are teaching us is a long process and is something that needs a lot of resources and a lot of engagement. But that is what is going to make the needle move and bring those prevalence down. The acceleration plan as a core element in terms of which intervention. The core element of the acceleration plan is a WHO technical package to stop obesity. A fundamental framework that was used in the development of this package is, first of all, to put in place a sort of a power sharing platform where all the different actors contributed from the start to the design. And when I say the different actors, I mean, of course, the international agencies that are producing guidelines, evidence-based guidelines, but that is just the first step. It's not through the development of guidelines that we will accelerate the impact in countries. Also, the academy, the civil society is fundamentally important. They are the allies of the response. In fact, I should say, probably the best ones. And to say, and I kept it last because I want to give a particular focus to this component, the people living with obesity and the communities affected by obesity as equal decision maker in what is going to work to solve this issue. The WHO technical package has been a long process for this reason because we went through different multi-decision component analysis. I don't want to share the methodologies, but it went through an analysis of all different possible intervention, and there are tens and dozens out there. And we came up with 3 areas of intervention that are environment, including early food environment for the general population and active environment, and also with an inclusion of school setting, extremely important. The second one is a health system transformation. And the fourth one is all that skill building in the society. Advocacy education is important, but we need to take it a way further. And that further is to build the skill in the population, starting from the early ages, to really not only adopt healthier life, demand healthier life, and demand the right to move, demand the right to healthy food, demand the right to care. So I'm going a little general here because what we have seen in the acceleration plan with 34 countries developing national acceleration roadmap, that each of them look different. Across these different, only 15 interventions to really design a prioritized response that were across these 3 different areas, each country shaped it according to the local context, to the local epidemiologies, to the current national health sector strategy in plan, either for nutrition, obesity, NCD, whatever that was, to the different focus that the responses wanted to have. So just to come back to your response, there's not one size fits all. There's not one intervention that is going to solve the issues. We do know that multi-sectorial response is working. We do know possibly we are starting to see the first result, but not as much as we would like to see. We do know that it has to be prioritized. We do know that we need to put a lot of focus on the implementation. And also, of course, the evidence is showing that some interventions are having an effect. Definitely. SSB taxation, front of pack labeling, these are very powerful interventions. We do, once the disease is established, treatment of obesity can be a very powerful intervention, but not treatment per se. It's not going to have like a medicine focus response. Care and treatment in the lung system and the chronic care disease. We are going to go back to that later. So this is the message from WHO, but in terms maybe of specific national health plan and how this WHO technical package and the acceleration plan platform has been used, maybe Simone can provide such a better answer than me. So if you allow me, Ali, maybe a couple of minutes to you, Simone, if you can really see how the approach of WHO has translated into a national health plan.
Yeah, would we be able to get
putting you on the spot.
A handheld microphone to Simone, please?
Thank you, Francesca. I was going to ask for the word at the end, but just having this opportunity, yes, I had to mention that having the structure of the acceleration plan has been very helpful to Mexico to be able to talk with different sectors and to try to identify options and get support, international support to push these policies. We have been able to implement soda taxes, warning labels, which right now, we just published in PubMed the preliminary impact of the warning labels, and it's amazing. We were able to reduce nationally 8 grams of sugar per liter in all the beverage in Mexico. So this is translating already in reductions in triglyceride levels, which is an early health effect of this policy. We also, this year, we implemented a school national plan similar to the one in Spain, in which all the junk food is banned. And also, we are working reforming the health systems to update the protocol. So really very compatible to what we are looking in the National Obesity Action Playbook that we have here, and also with the Obesity Acceleration Plan. And only I was thinking that in addition to what Francesca was mentioning about the health system transformation, we need a parallel food system transformation, which is also very complex and needs a lot of participation of different sectors. And the other thing that I have to mention is that all of these actions, we are all agree that are necessary. So why is so difficult? And we need to mention that is because there are many conflicts of interest and industry interference in pushing these policies, basically from the junk food industry. And that's the elephant in the room for many of the things we do. It took us 12 years to implement soda taxes and about 14 years to implement the warning levels. And we have 5 years with warning levels and soda taxes, 10 years, and we are still defending these policies every day. So we need also to raise that point in these plans, because this will be for all the countries, this will be very important interference, and we need to learn how to enforce that from the government, and obviously with a lot of support of civil society. Thank you.
Thank you so much. Thank you, and it's great to get more perspectives here, and especially the country level implementation perspective here. So Martina, I wanted to come to you next, because I know that France has been quite active in addressing obesity, but there are still some issues there in terms of the response. And I know that picking up on Francesca's point about the political will and really sort of getting obesity prioritized as a public health priority, as Yanis had also alluded to earlier. And I was just wondering if you could tell us a bit more about, especially in France, the issue around obesity not being recognised as a disease, and what sort of issues that creates in terms of policy making, but also the practical day-to-day treatment that you're involved in as well.
Thank you. Thank you for giving me the opportunity to speak about national point of view, France, and the point of view from a clinician and researcher that I am. Of course, the rate of obesity in France is less than in Greece, but it's still increasing, and especially with a lot of discrepancy, and it's increasing in some region, and also, of course, in low-income people. And it has been reinforced by the crisis, the different crises, COVID, Ukraine, and so on. So we are worried about that, and we still need to have more data in low-income people. That's not the data we usually have. So that's why it's so important for us to have a real recognition of obesity as a disease as such, and not only as a risk factors for those diseases. And at that time, it's not so clear in France. In France, it's rather complicated to have the recognition of NCD for a disease, and obesity is not on the list at the moment. And it's so important, in fact, for the politicians, for the reinsurance, but for the people. When you are people living with obesity, at the moment, it's very difficult to go to your GP, your doctor, and say, help me. Because if you not have a disease, you are afraid that they will say, you have to change your lifestyle. But if it's a disease, you can say, help me, I'm healed. I want to. It's not a matter that I don't want to do something in my style life, but I need to have a real management of my disease. That's why it's so important. And it's also important in general people's mind. We are looking at this pandemic, as Francisca said, that's global pandemic. Weight of the whole population, nearly everywhere in the world, is increasing. That's not the fault of these specific people. It's a global thing due to this obesogenic environment. And some are able to resist because they have good facilities, good genes, and so on. And some will develop a real disease that could be preclinical and clinical. I think it's very important, this new definition we try to put on the topic. And these people needs to be help and management of their disease. That is not that you should not have prevention. And this opposition between treatment and prevention is crazy and deleterious. Of course, we need to decrease the pressure on everybody and to treat the people who develop the disease because they don't have the good condition, they don't have the good gene, and the pressure is too heavy for them. I remember a cartoon from the Finland. Finland have done a lot of things in prevention, and this is a cartoon from Pushka that you see a people on a slope, and people is pushing a ball. The ball could be adipose tissue or else. And they say that it's the problem of the people to push the ball, but it's the problem of the society to decrease the slope. And really, I think it's important. We need to treat the people, manage the disease, pushing the ball, helping the people pushing the ball, but the society should decrease. And as it has already said, it's not only one thing you have to change, that's a problem. If obesity causes was only soda or only physical activity or only, I don't know, it will be more simple, but it's a global thing. And you have to treat everything, to act at all the level, education, food industry, physical environment, and so, and especially in low-income people. So it is very important. In France, despite there is no official recognition, we have launched some roadmaps. The first one was in 2010. It was the first roadmap on obesity. And it was not, they don't put a lot of money, but they have done something, and it was Professor Badvan in Paris that launched that, is to set up a center for treatment of obesity. Center of excellence to treat the more severe obesity. And it was the first time that obesity as a disease entered in university hospital. And 37 centers scattered in the France were mostly in the hospital, university hospital, to treat the patient, the more severe, because there's so many patients, it was not, but it was the more severe, but also to develop research, to innovate a new way of managing obesity. And that was very, very important as a signal that obesity is really a disease that could be treated in a university hospital. And it was a surprise for all the specialists, cardiologists, and so and so. And it was not so easy to develop a team around that. But after all these years, we have in France a network of people deeply involved in obesity research, in obesity treatment, knowing each other, and very efficient. That was simple. The government put very, very low level of money. It's a little bit increasing now, but the ratio between the money put and the signal was very, very important. Unfortunately, the second roadmap started in 2017. The first stop in 2015, and always the problem is continuity, really. And in 17 is had some problem because rapidly there was a COVID. And the COVID was very important because we saw the people dying for obesity. The people who were dying the first were the obese people. And so it was very terrible, but we can go to the politician and say, look, we have the data. It's very, very severe disease. But we have some problem with the government, and we are still waiting the new roadmap. But we have also innovation in care. Innovation in care in order to have a global management, not only with MDs, but with nurses, dietitians, psychologists, sport coach, to have a global management of obesity disease. It was an experiment that was launched. There is now some experiment for innovative pathway to treat people in all the disease, and our community of workers on obesity is very active, and we have launched many, many experiments, and one has been evaluated as very successful, and it will be now, we hope so, soon, in the usual care that the people living with obesity could have a global management of their disease with multi-professional. That's very important. And we hope that it could be really promoted, but we need to have more health workers in the field with a good knowledge about obesity, and that's a problem. We are lacking of a lot of professionals, and we need also to increase the knowledge about obesity of health professionals, all kind of health professionals, but also social workers. Because I was saying that low-income people are prone to obesity much more than the others, and they are often working with social workers, but the social workers does not know anything about obesity, and they could stigmatize the people and say, you have to eat differently and to walk and so on. But we have really to increase the knowledge of the whole population on that. And about prevention, we have launched some experiment about prevention, focus on children, adolescents, and young parents in low income, with intervention, we say, at 360 degrees to have all the components, and we hope we can do something to tackle this massive problem.
Yeah, thank you. And I think it's great that you've given us such a great view of how the multidisciplinary
So
management works and that really holistic management. And I wanted Dan to bring you in here to talk about, again, sort of zooming out on the policy making here and, you know, the role of industry, NGOs, academia, governments, and how all of those players can work together to sort of help to tackle obesity at a more sort of policy level.
Yeah, absolutely. I'd like to talk about it. I'm so happy to be here and the energy in the room today and actually seeing some of the work that some of us have been looking at for 6-7 years, and I know some of us much longer, actually coming through with great global leadership that we're getting now through the delivery plan and the acceleration plans and seeing what's going on in countries. It's truly exciting. I suppose that maybe the thing with obesity as a space is there's just so much there and so many different elements to go on. And I was having a great conversation with Simona earlier on about how so many different interests play into it, that you get a win and then you have to hold on to that win to get the next win because of the multifaceted nature of it. So I'm really, maybe if I take it really back to basics here, we will not hit SDG 3.4 for a 30% reduction in NCDs unless we get obesity right. We have in our hands now the tools with which to do it. We have some great policy alignment. We have technology coming online in different parts of the world. We have obviously treatments, medicines, interventions that we have as well. But I think the one thing that we have that we didn't have 10, 15, 20 years ago is an understanding of the science of obesity. Obesity is more than we thought it was. And we based, especially in the Northern Hemisphere, we based our health systems on a partial understanding of obesity and the part that it plays in our health systems and society. And for that, we have seen rising incidences consistently of obesity. We now know that move more, eat less on its own is not enough. We know that obesity is about your genetics, it's about your environment, it's about your psychology, it's about your biology. And that means that it's had to not just find a new way of looking at things, but we're having to rethink how we did things before as well. I think what's really exciting at the moment is some of the coalitions that we're seeing forming in this area, the way that the science can come together with the health system, with the public health, with the lived experience of people living with obesity, because that's where it all starts from. We've been having some very interesting conversations with people in Brazil living on low incomes there, and they're telling us, you keep telling us what we need to do. We all know what we need to do. We know how to, but we can't do that from where we are. Yeah. So we've created this world with this degree of complexity to it. I think the cross-governmental element to this and the policy making is absolutely critical. I don't think that health departments can solve this on their own. I certainly don't think that public health can sort it on its own. I think the science tells us that. And what we're starting to see now is some services across the world starting to look at what if we followed the science and built a service based on the patient and around the patient, based on the science. What would that look like? And that's different in different countries, and it's different for different communities. And the promises of the technology that we have coming through now, whether it's AI, I spent some time in Abu Dhabi just recently looking at how some of those countries they don't have the legacy health systems in the same way, they can start from a different point, can start now thinking about, okay, now we have all this power, what will those services really look like? In terms of the cross-government piece, which I think which I think is absolutely critical, in many ways you can see obesity as a resilience issue in our societies now. How are our health systems going to be able to operate with more and more people with NCDs going through our health systems? How will we cope in a future pandemic? How will we cope, to be frank, when our health budgets are possibly going to be cut as they go more towards defense and a changing world that we have, or anything else that we have? And so I think, to the point from my colleague from Greece here, in a way, this world is actually making us look at our health systems anew. And how does that work for a cross-governmental approach? The resilience messages that we have around that resonate with treasuries. They resonate with investment, with business, as much as they resonate with health. And so when we say that obesity is a whole of society problem, it's also a whole of government problem. And I think the really exciting thing from a policy side that we're starting to see now is some governments are starting to get it. Treasury ministers are starting to talk to organizations about, okay, how am I going to get a handle on this? And I think what we're seeing here, and what I'm feeling is coming through quite strongly now, is I think the time now is to gather all these experiences of the piecemeal interventions that we've seen across the life course of patients, and actually maybe start moving towards something a little bit more concrete that will be different in different countries. Let's start looking at a broader, stronger coalition, new ways of thinking about working with industry, with science, with communities, that meet obesity where it is, from where the patients are, and then we can look towards freeing our societies, our economies, and our people from some of these conditions.
That's a great answer. Thank you, Dan. And actually, that was something that I wanted to bring Yanis back in on as well, was you mentioned about in the Greek plan that you've put together, you've got a lot of different ministries involved there. And I was wondering if you had a few sort of key takeaways in terms of how you got those different ministries engaged. How did you get that political will and that political leadership?
Yeah. Well, I'd just like to also include some of the points made by Dan and Francesca and others. I mean, first of all, just to, because they were very interesting. So I'd like, for the citizens, you know, I don't think there is a politician in Europe, at least, who does not understand that his re-election is directly linked to having a strong, resilient, and cost-effective and citizen-friendly and egalitarian health system. There's no, and at least in Greece, there is all the political parties are very clear on this, and the priority is being given on this. We saw what it did to Brexit. I mean, the national health system, how it affected the Brexit referendum. So I don't think there is a lack of demand. I don't think there is a lack of demand in that. Now, on the costs and the treasury, that's a very interesting point. I think treasuries need to understand that by spending 10 euros on prevention, you're saving 100 euros in actual health costs, right? It's the same with road safety. If you reduce accidents by 20%, you're probably going to save billions from your treasury. So I think there is a rising awareness of this. Now, just to respond to the question. So as we said, pandemic, all these crises we faced recently, the economic crisis for Greece was particularly hard. What did this mean? It meant that the government had to put in place a very strong coordination mechanism, and that's been done. There's a General Secretariat for Coordination, Ministerial Horizontal. There's a General Secretariat for Strategic Foresight, which is important because the strategic foresight is preparing an AI hub for health. So which is strategic. It's a strategic move because This will ensure cost savings, better access, better data collection, better policy formulation. So it's really strategic, and we're cooperating informally with you on this AI hub we're setting up. So the coordination mechanism that was set up has been sort of perfected. It's not perfect, but it's been improved through the successive challenges we faced. And here I would like to mention a little bit what's going on in the World Health Assembly, because yesterday we adopted the pandemic agreement, and because obesity depends on the resilience of our overall level of our health systems. The pandemic agreement is very important in this because it's going to help us all to make more resilient and to ensure that all health systems around the world are at a more equal level. Because otherwise we cannot face the next pandemic. There's no way. If we have inequalities around the world, this will affect everybody. And that is one of the main aims of the pandemic agreement. Now, so we have this coordination mechanism, and this coordination mechanism ensures that there are three fundamentals in the health policy: prevention, risk reduction, and reducing inequalities. So this is prevention is horizontal, risk reduction, environmental factors, Ministry of Environment. What are they doing for air pollution in the major cities? There is this coordination way. And reduction of inequalities, there's also a horizontal planning for doing this. Also, the coordination mechanism is very important because it's data collection, enforces digitalization throughout the system. This brings back accountability because you have a much clearer picture of which ministries are actually performing their functions and achieving results and which are not. So you can have interventions for improvement. And then the coordination has to ensure that we mainstream health aspects into the design of all legislation, health in all policies. We already mentioned this. The digital coordination, I think.
Yeah, I think you've made good points there in terms of how you've achieved that sort of that cross-cutting aspect and that cross-cutting approach and those sort of themes that are above any particular sort of therapeutic areas or particular disease areas. And Francesca, I wanted to come to you next because obviously you work for the World Health Organization, but do you have any experiences that you could share in terms of where countries have been particularly effective or your organization has been able to sort of really engage those stakeholders outside of health and create messages that resonate with them to understand, as Yanis had said, what the power of investing in, say, prevention and management of obesity could be in terms of returns in economic gains and things like that. If you've got any sort of insights you could share there.
Yeah, thank you, Ali. Indeed, going back somehow to the roots of the problem, this is a very multifaceted disease somehow, and as such, and we have seen it in multiple situations, it does need a multi-sectorial response. With that premise, the collaboration across ministries is essential in shaping the response, and this is one of the essential elements indeed that each country has to put in place when integrating the response to obesity into national health sector plan or NCD strategies, or when starting from scratch and having a prioritized response to this single issue. What we've been observing, and I'm somehow sharing the experience from the country, especially from the acceleration plan, because these are 34 countries that WHO is working very closely with, is that the first mechanism that countries needed to put in place is really in whatever forms that takes place. Yesterday, the Minister of Brunei was speaking about an obesity task force. The same Thailand did. Brunei, South Africa has a similar mechanism where different representatives from the different ministries come together and agree on fundamental components that the country should take in place. And I just want to give you some example here. If, let's say, a country decides to focus on health system transformation, let's say, and we have examples of countries that across the different 15 intervention that the WHO technical package proposes, they selected school policies, SSB taxation, and integration and scale up of prevention, care, and treatment services in the health system. So, you know, as simple as that, and possibly as impactful as that, let's say. In that specific context, the country had to put in place a decision-making group that was representative from the different ministry, let's say, but in a way that is tailored to design and roll out these 3 different policies in the lens and the perspective to have an incremental response, but let's start with a selected set of priorities, let's focus on that, let's have them work consolidated and expand. This is a fundamental principle of implementation. We cannot aim to have 67, 65, 200 interventions under a national health sector plan. It's going to be impossible to implement. So that implementation lens has to be there from the start by design, and not by, oh, okay, now let's design a comprehensive plan with 200 interventions and then we implement it. No, let's design a plan that with very clear target for the medium and short. If you take these 3 different policies, what do we need? We definitely need a representation from the Ministry of Finance, from the Ministry of Education, from the Ministry of Health. We need the civil society. We need the academia. We need the professional association. We might need the Minister of Trade or Commerce. We might need the Minister of Agriculture. And it's not just because we need an inclusive representation, because we want to be inclusive, but because we need this decision maker to be part of the design and of the solution and the implementation of the solution. If we, something as simple, quote, quote, simple, health system transformation, okay? Let's say health system transformation start from the primary care. You know, all multidisciplinary team and tertiary care is beautiful. It's needed, but it's not going to be the reality in low and middle income countries. This is a disease that hits all countries and doesn't spare anybody. We will not be able to have psychologists, dietitian, sport coach, and endocrinologist in a primary care facility. So that is something, that primary care facility has to be enabled and has to be the referral point for school. School health programs need to refer Ministry of Education, something as simple as checking a child or an adolescent or a student and monitoring the metabolic status, monitoring the growth. When something is not working, that public health program in school that is led by the Ministry of Education has to communicate with the Ministry of Health. So I just want to give an example of how this multi-stakeholder national partnership, yes, they are very important in terms of political commitment, but they are also very important in the nitty-gritty little things that make that needle move. I just want to give you another example, and we observed that, for example, in Mauritius, school policies and sustainable school policies and local food procurement. The country put in place a program where for nutritional healthy meals in school is starting with that. But they also wanted to link that nutritional healthy meal with the local production of food, so that emphasized rather than Mauritius is an island. So there's a lot of importation of food from the African continent and elsewhere. But they wanted to link that specific policy intervention with the local food production also as a way to somehow incentivize the local farmer and the local companies. So it's another practical example where there's a fantastic task force that is at the national level needs to talk and say, okay, If we want to have nutrition and the Ministry of Health, how should we design the meals? And that's how should we deliver? Where should we get the food from? And so that agriculture collaborating with education, collaborating with health, even in the little details that sometimes are overlooked, but they are making the change happen. So this is just few messages that say this multi-stakeholder, multi-sectorial partnership are essential in terms of political commitment, as essential down at the subnational, provincial, county, facility level to make the change happen. Change starts small. And we shouldn't be discouraged saying, if a local community has done well, it's never going to be possible at national level. Yes, sometimes yes. It's possible to replicate, consolidate, and bring to scale. That is another essential element, bring to scale. That's what we need.
And I think that's such a good way to think about it as well, is that this multi-sectoral involvement, it's not just in the design, it is in the follow-through, it's in the implementation, it's in the monitoring and the evaluation. It's not good enough just to say, you know, we sent our plan to the Minister of Education and nobody read it. You know, it's really important to make sure that that's meaningful engagement across government. And I'm just aware of the time, and we've got such a great room full of people from representing all of the sectors that we've been talking about. So I'm keen to move on to our roundtable discussion soon, but I did just want to ask each of you in turn for a very rapid fire answer. So you'll get 1 minute, and I will be a harsh moderator on this one. We've got the UN high-level meeting on NCDs coming up in September at the UN General Assembly. We see that obesity is not specifically on that agenda at the moment. I know that there are advocacy activities, etc., going on to try to change that. And I was just wondering from each of you if you could say, what would your hopes be for the outcomes of the UN high-level meeting, specifically with regards to obesity? And I would ask 1 minute each, please. Yannis, take us away.
Well, obesity may not be on the agenda, but it is on the agenda because it is an underlying factor for all these NCDs. So obesity will be a major discussion point because it will be addressing the root causes of all these NCDs. So what we would like to see is raising awareness of the contribution of obesity to all the NCDs, the need to tackle obesity at a base level to prevent NCDs, and just to raise awareness about the pandemic level character of treating obesity.
Fantastic, thank you. And Martine?
Of course, it's the knowledge of this pandemic that should be the priority at all national, international level, of course. And we should also need to have accurate data, because obesity, in fact, is an invisible disease, even if it's very visible. Because in France, but in other countries, there is no code to detect in the healthcare system obesity. It's not code, but it's not a disease. And even the surveys that are done in each country are always or more cohorts. There is volunteers. That's not the reality. And we need to have data and survey of the evolution of this pandemic at each local level.
Fantastic, thank you. And Francesca, your hopes for the high-level meeting in September as well?
Well, we are working very hard, in fact, with political support, and we have countries that are very committed to take it up, and Spain, Mexico, and South Africa and Brunei are really trying, and possibly Greece as well, I hope. Many of them are really trying to lift up obesity and not being considered as a risk factor, but also the hope is one, and something that, sometimes the hope is that obesity doesn't come alone in most cases. 80% of people with diabetes have overweight or obesity. Between 50 and 8% of people with diabetes have hypertension. Between 50 and 8% of people with obesity have hypertension. So what I'm trying to say here is that we should stop to consider and single out obesity, eat well, move more, less focus on prevention, the 5 dichotomy, prevention, care, and treatment. This is a disease web that has to be managed together with treatment and care. Okay, we are not talking about only pharmacological treatment, although pharmacological treatment is a very important element. We're talking about a people-centered approach of, in most cases, or in a majority of cases, the same person with multiple disease managed by the same provider in the same system. And the approach should be integrated. Let's manage together. Let's lift up this disease web that is actually one of the major determinants of the current NCD morbidity and mortality. We also have some powerful tools, and hopefully this will become even more accessible. And let's not forget that some of the current medication, for example, GLP-1, that are a very, for now, the only pharmacological treatment that offer a possible solution, are effective for obesity and diabetes. And when they are used to manage a person that has obesity, diabetes, and cardiovascular risk, their efficacy and effectiveness can increase by 100. So we have to look at this prioritization, and we have to look at this integrative approach of managing these diseases that are currently determining one of the major burdens in the world across all incomes and across all populations.
Fantastic, thank you. And Dan, to finish up.
Yeah, so I think probably and I've spoke to a number of people in the room, I think quite a lot of us are a little bit disappointed with the zero draft that we've seen and where obesity is within it. Maybe to just put a quick shaper and add to your piece there, we know that if you're managing a person with 3 NCDs, it's costing a health system 10 times more than manage them with 1. We know that obesity is at the root of a lot of these conditions. It's time, we feel, I'll take a step back. What's the question? Why should every government get behind obesity? Why should every organization want something good out of hunger? It's because if we tackle obesity, we are adding healthy life years to people. Nearly every country, whether from an economic point of view, from a humanitarian point of view, or from a health view, gets it. We're all struggling with, we haven't got enough people working and living well long enough to sustain the lives that we have. We believe that at the very least, we believe that the high-level declaration should recognize, as the WHO does, that obesity is a disease, and recognize its connection to the other NCDs that are in there, and see it as a way of reducing the burden of those other diseases and helping to free our populations from NCDs as a whole.
Fantastic, thank you. So we will move on to our roundtable discussions now, but thank you to our panel for a fantastic discussion. So in terms of your tables, what we're going to do is we've got 3 questions for you. We'll give you 10 minutes on each question. I will move you along as we need to. But the first question is, how can societies accelerate progress on achieving the UN SDG targets for NCDs? So what specific policies could help to accelerate progress around the SDG 3.4? But also equally reflecting on what the panel have just talked about, what are your hopes for the UN high-level meeting in September? What would you like to see coming out of it? So take it away on your tables. Thank you so much.
Thank you. Hi, everyone. I'm Sean Taylor from World Heart Federation. I'll be quite quick because we touched on a lot of the same points as what Johanna mentioned. But for the first question in particular, I think we went a little off tangent and kind of got talking a lot about the difficulties of implementation and how the kind of national plans and the frameworks given for national plans here are very helpful, but what that would look like and particularly how you would be able to make that a reality through policies and programs in the country setting would be very difficult. We talked about how we were kind of wondering about capacity at different national governments as well for that sort of implementation and adaptation, and how that is very important to both build and to provide technical support for, to make sure that these the kind of policies and programs that are recommended in these sort of national frameworks are made a reality. So that was a big point that we discussed for the first point. I mean, we talked about how the targets, the 2030 target and the 3.4 target, we know so many countries are off track, and in reality, it's not going to happen, particularly with the challenges we have coming with, increase in defense spending, financial crisis, and difficulties in governments then being able to commit more spending to healthcare. So we got a big challenge ahead in terms of making the cases for a lot of these policies. And similar to the other group, we really addressed the second and third questions together, both out of time and because of the commonalities in the question. But we talked about the need for really making the case for improved understanding of the social determinants of health within government, and we know that in certain instances there's this kind of hesitancy for government intervention and spending on a lot of kind of public health policies or policies that aim to nudge behavior, but in reality those are really critical when we understand the biological and the environmental determinants of obesity and other non-communicable diseases. So that's something that really needs to be promoted and that governments need to understand and take care of. We talked about the need for health impact evaluations in all policies to ensure that there's firstly no harmful policies to obesity, but also a kind of priority on improving obesity and other non-communicable diseases in policies across government, and drawing on the great example from Greece about how they're doing that. And yeah, really the need for the dual healthcare and public health approach, which came back to some of the points we discussed on the first point, that we know the prevalence and burden of obesity and the related non-communicable diseases is huge. We're not going to be able to do it without strengthening the public health systems and improving access to treatment, but thinking about the long term, the public health approach, particularly interventions in childhood, is essential as well.
Fabulous, thank you so much. And to the middle table at the front here, please. 2 minutes, thank you.
Hi, everyone. I'm Liz Arnance from NCD Alliance, and I will answer the first question, and we'll hand over to the others for the other questions, as all of us, I think, bring different experiences. So for the first question, I think we did, obviously, political commitment on obesity was something that came crucial for achieving SDG 3.4, echoing also what the other table said and the panelists. And so I think we said we need to tackle both transformations for the foods and health systems, which also was mentioned by the speakers. And then I think when talking about food system transformation, we need to make sure that we are addressing both ends. So on one hand, trying to disincentivize unhealthy diets, but also trying to make healthy diets more accessible. So very crucial. And then in terms of also improving food environments, we were talking about the importance of regulating. So important, obviously, to have health education programs, but regulation and law are crucial tools for improving such food environments, because self-regulation has proved not efficient enough. And then we also mentioned the importance of monitoring and evaluation, aiming for result-based budgeting, and if results are not met, how we redesign policies. And then also we talk about the potential of digitalization to improve management and prevention of NCDs, but also being very careful about the fact that digital environments are also increasing personalized marketing of unhealthy products and the consequences it has. Maybe one point was important was around reviewing current policies. So rather than building things from scratch, what kind of policies countries have that could have a stronger lens around health and obesity prevention and control. So like social protection policies that already exist, how can we make sure that they have health impact assessments, like school meals, including nutrition standards, etc. So I will hand over to you for the second question. Oh.
Can we just have a brief 1 minute, please?
Okay, I might actually hand to my colleagues from Qatar who have some really good examples from their implementation.
So I believe there should be a combination of leadership and cross-sectorial integration and accessible preventive services to have like a holistic approach for obesity. Like in Qatar, we have designated a National Sport Day on annual basis to promote active lifestyle across the country. And we have adopted like health in all policy approach, where there is a representation of all concerned ministries, urban, school, health, everybody on board. Health impact assessment also is a major part to assess major projects and their impact on health. And even within the healthcare system, we have dedicated healthy lifestyle clinic in the community, in the primary healthcare setting. And it's for free, where we assess a patient with non-communicable disease to assess them for obesity and refer them to the dietitian and to the gym for free as well. In addition, I believe that we need to look at obesity as a disease where it's beyond nutrition and exercise. There should be a holistic approach to look at obesity in terms of hormonal imbalance, intoxication of environmental, food, and other stuff. Thank you.
Thank you so much. And the table at the middle at the back.
Sure, hi. So I've been told to be the spokesperson. My name's John Schoonby. I'm the Chief Medical Officer of Swiss Re. So we've got a slightly different take, which I guess is partly my take. So of course, obesity is a huge risk factor. It's a big problem. But to consider it the root cause of NCDs, we kind of challenge that a little bit, right? It is an NCD, and the root cause of NCDs is really insulin resistance, right? In 1988, when metabolic syndrome came about, it was called insulin resistance syndrome, right? And insulin resistance, we believe, is the big driver. And if you look at the carbohydrate insulin model of obesity, nutritional guidelines, we believe, are still a problem. Everyone seems to think people just aren't following the rules, and we know what people should eat. So we hope what comes out of number one is a refresh and an acknowledgement that we maybe need to relook at nutritional guidelines, and particularly the macronutrient, the portions of carbohydrates and fats that are out there. So that's kind of the main one in terms of number one. The other one, which is a really good one, is to have targets for children, because we believe if we have children targets in there, it would bring a lot of people on board. And then number 2 and 3, we kind of we didn't really follow the program. But I think prevention, right, was a really big key for us. And that's another one, funding for scale-up. So we do a lot of pilots where we do various things to try and improve, but then when we get to the scaling up, the funds aren't there, or maybe commercial interests aren't interested in funding that. Thank you.
Fantastic, thank you. And the table in the corner here as well. 2 minutes, please.
Of course, yeah, thanks. My name's
You have a microphone there if you want to use it.
Hi, so my name's Frank Smith from Transform Health. We had a great discussion here. I don't want to repeat what everybody said. One of the things that we felt was the question was a little large. There's great differences between high-income countries dealing with NCDs and low and middle income countries, many of them dealing with a double burden of disease and very different health systems. So we may have to rethink that a little bit. I think what we came to the conclusion is that we know what the solutions are. I mean, you know, with a few caveats that we can, we need to invest more in certain areas of R&D and stuff like that, but we know what the solutions are. I think this, at the heart of it, there seems to be a paradox, because we need policies, legislation, regulation, funding and budgets, but there's how we achieve that. Do we tax certain foods more, but then that incentivizes governments not to do anything about it because they're getting more revenue from certain foods that are taxed, and then, you know, investing in the health system to cover other. So, or do we, you know, look at insurance schemes and how they can incentivize behavior change? I think what's really important is for us to try, as a community, to try and simplify the narrative that's currently being obfuscated and confused by different interests, and try and really drive for clarity and for government action on this that's determined and sort of based on a movement of engaged citizens and other organizations that are really driving this agenda forward, to try and implement some of the solutions that we know are well known and out there. I'll leave it at that, I think.
Fantastic, thank you. And then to the last table.
So good morning. My name is Francesco Branca. I'm working at the Institute of Global Health, University of Geneva. So we also had a very lively conversation. And to the question on how to accelerate progress, clearly there is still an issue of political commitment. That's what the NCD high-level meetings are for, but also that's why we have discussions in global fora in Geneva, in New York, in Rome. But so that's necessary, that kind of commitment is needed, but the implementation is lagging behind. We have largely a list of effective policies and programs, so there's basically no justification not to take the action. So why there's no action? And the reason is that there are contrasting forms, and this is a big elephant in the room. We have a food system transformation that is increasingly looking at food as commodity and not food as something which is a common goods, led by concentration, financialization of food industry. So there is, unfortunately, what we were hoping at the beginning, at the first meeting, was to have food industry as an ally for the transformation. It's not happening. So clearly there must be action to address that, and the accountability of industry was mentioned as an important action to take. NGOs will have to be a driving force to call industry accountable. But we also have an issue of the data. So, having clear data about the prevalence, the impact, the health impact, and the economic impact of obesity is something which is needed exactly to drive those responses. We also talked about the need to combine adequately prevention and management, and health systems need to change indeed. Health systems, first of all, need to have a clear, to adopt clearly the concept of obesity as a disease, but the capacity of health workers to diagnose obesity should be improved. Not all countries have adopted that definition. The problem needs to be better recognized at all levels of population. Management will benefit, of course, of the latest discovery of science, but they need to be adequately used, and the use of pharmacological treatment is clearly important as part of a comprehensive way to address the problem of obesity. Adequate care, adequate use, following the indication and the protocols, and not going beyond those indications, and including the pharmacological treatment as part of a comprehensive healthcare approach. Thanks.
Fantastic, thank you so much. So thanks everyone. I think that was a great table-based discussion. I could hear everyone having lots of really great conversations, and I really liked hearing all of the very practical takeaways that you had from this. And I think, especially when you've been working in obesity for a long time, like I know a lot of you have, it can feel like we're having the same conversations over and over again. So I think one of the things that I've really enjoyed about the conversation we've had, both the panel and then on the tables today, is we've really sort of tried to dive into some of those practical solutions. So what could we be doing differently? How could we, where we have these lists of interventions that we know are effective, etc., how can we make the arguments and make the case, get that data on health outcomes, but also economic impacts, so that we can get that full cross-sectoral sort of almost obesity in all policies sort of approach happening here. So I thank you all very much for attending today and wish you all a very pleasant rest of your stay in Geneva. Thank you.